there is a huge link or increased data that shows a link of prolonged catheterization with bladder cancer development. So when we were looking at inflammation, right, we were saying, okay, what are the factors that are being induced? And we found that we look at bladder cancer markers, we look at inflammation markers, immune response, everything. And we see that many cancer markers, they have poor prognosis in other cancer systems, in other parts of the body. They would be inactivated in the bladder, in the catheters. By 7 days, we can see a huge increase of these bladder cancer markers, and that keeps going up to 28 days. The question is that we don't know, as soon as you remove the catheter, does that go back to normal and then nothing happens again? And you just need to have this constant inflammation to actually develop these abnormalities and these carcinomas, right? Which is normally, we have seen that like a gut inflammation may result in a colon cancer, right? So we have many examples where the inflammation plays a role. You don't have to have genetic factors that predispose you to develop cancer. We can see the development of cancer due to inflammation. Right. So we saw that even at 28 days that these blood cancer markers were highly elevated, right? But now we need to test if we remove the catheter, do they go back to normal or this proliferative behavior stays there? So when is the point of no return? Is 7 days good? 24 weeks is good, and then you remove the catheter and you go back to normal? Do you need to have it for 3 months? Right. So then, remember, cancer is a silent disease. You don't notice until something is really bad. Yeah. So right now we're doing research on that. We're identifying the markers that are more exacerbated when you put the catheter. But the cool thing that we have found is that now we're testing the liquid-infused catheters that reduce the inflammation, and the majority of those bladder cancer markers totally are reduced.